Good morning, lovely people. Welcome to another episode of the Daily Dose with me, Dr. Swail Essa. Today, I think, is episode 8. Yeah, it's episode 8 today, guys. And we're discussing how effective has the lockdown been? So, I've got mixed reviews from people. More people are saying it's not effective, and less people are saying that it is effective. But let's look at the data. Let's look at the facts. Let's talk about this real good. Okay, so how well are we doing? Let's just look at the figures. Okay, so from the last confirmed stats, we've got 1,400 positive confirmed COVID-19 cases. We then have 5 deaths. We've got a certain number of recoveries. I didn't really even look at this because when it comes to recoveries, I don't think it's going to be fully accurate. I don't think that people are going to be tracing every single person down, offering them a new test after 2 weeks to test them again and confirm that they are now negative and they have shed the virus, like the virus is not in them anymore. I don't think that that's possible. Yeah, I'm a bit skeptical on those stats about the recoveries. And then you've got more than 30,000 tests being done, which is great. Really, it is. Because if you just look at these stats, we are doing really well. We went from the early days of the COVID-19 pandemic in South Africa, where we were actually doubling in number almost every day, doubling. To now, where in the last few days we haven't grown exponentially. One might even say we're coming close to flattening the curve. Who knows? Only time will tell. It's a bit too early to say that we've completely stopped because these are the early phases of the lockdown. And I think the main reason for the government locking us down is that I am sure government has looked at this from every possible angle. Now, are people complying with this lockdown? For various reasons, no. Now, obviously, for the average middle class citizen, most middle and upper class people can afford to stay at home, can afford to be in their house. It's easy for them to do so. They can work from home. You have high speed TV, electricity, running water, food, everything you need is under your roof. So you don't have to worry. Why would you have to run outside in the streets, be in crowded places? You don't need to worry. You and the rest of the people that can afford a certain lifestyle. But for those who can't, it becomes very, very difficult for them to stay away from crowded places, from going to work, if they really need the money. So, for a lot of South Africans, they don't have the luxury of being able to stay at home. I mean, how are you going to social distance if you live in a house with 6 people on top of another house that has another 12 people? It's going to become very difficult to socially distance or to maintain hand hygiene and sanitation when you don't have running water. So, although the lockdown, for various reasons, people are complying and not complying, like even middle class people, apart from the fact that we have all the luxuries, we have TVs and food and running water and everything in our homes, we still need to leave for some reason and go visit our friends and have fun and pretend like this is one big vacation. And I don't think that's fair on the rest of South Africa that are suffering every single day, living by daily wages, and using that just to put food on the table every evening. So it is quite difficult. Now, that was just the practicalities of it. But do people fully even understand the lockdown? I'm talking about intelligent to the lowest intelligent people in South Africa. I'm talking about the average man and the CEO. Does everybody actually understand what this lockdown means? How we're breaking the chain of transmission from one person to the other? I don't know. I really don't know. I don't think the average CEO has medical knowledge or understanding of how this works. So maybe, perhaps for a lot of South Africans, this is just a nice break from work. And then in 2 weeks' time, we're all going to come back and everything's going to be peachy. I think I have some bad news for you. Because look, currently, we have many South Africans who aren't abiding by the lockdown, be it middle class, lower income. Although the numbers may show that we're currently being effective, we could see a rapid rise in number of cases going forward based on the lack of practicality in social distancing. I'll give you one small example. The taxi industry has promised the government that they will shut down this country properly, like properly, if they're not making any money. So if the government doesn't comply with them and the government doesn't allow them to still run their business, they will shut down this country. Now, obviously, taxis almost could be considered an essential service. Taxis transport essential workers to their place of work. They are necessary, but as I'm sure we all know, they're overcrowded. 16 people sitting cramped against each other. It's a lot of people in a confined space. And now the government is even rolling out hand sanitizer and masks for all people that require the use of taxis to travel. Only time will tell whether this works or not. To make matters worse, we've had many clips of the army doing exactly what Cyril Ramaphosa told them not to do, implicitly. He said, don't skop and doner. This is not a time for skit and doner. And there, a few days later, innocent people were being shot at with rubber bullets just for queuing outside a supermarket to get bread, milk, their necessities, because they couldn't afford to stockpile. And they got shot at by the police. It's been intense. Obviously, you do get those people that wanted to drink in the streets and openly defied the army. But is it the army's right to enforce this type of martial law? Yes, I get it. Their job is to keep us safe, but at what cost? Because the government needs to take responsibility. The military are acting on their command. And if the command, as I heard, it was very clear, and they're defying that command, it's going to get problematic. More and more people are going to stop abiding by the government's military law. And I don't even think the military even understand what they're doing. Honestly speaking, do they really understand what the lockdown actually entails, what it's actually about? I've seen videos of the military running into people's yards and forcing them to stay inside their houses. What? Do you understand how this thing works? By staying in your home, the only people that you are exposed to are the people in your home. Your yard forms part of that home. What do you think? Corona only works? Well, Corona works inside the house and not outside. So let's keep it inside the house because the yard is public property. No, that's not how it works, bruh. You're not just allowed to shoot anybody that you feel deserves a shot. Come on, man. Yeah, I don't know how that's going to work. I don't know how that's going to pan out. But here are some potential limitations I have for this lockdown. So, apart from all the other things that I've discussed, um, we have a few issues. So, one, and in no particular order, bribery. Now, I haven't heard any stories or cases, but look, I'm sure a lot of that is going on. And, if people start bribing army soldiers as well as police, the lockdown is going to fail. Already, I see a lot more people than what should be on the roads when I'm traveling to the hospital. Like, all those people cannot be essential workers trying to get to work. A lot of those people can't be. So, I'm very skeptical as to where people are traveling on the highway. I don't see enough highway roadblocks. None. But maybe that's just my observation. I don't know. That's just what I've been noticing. Now, the next and more interesting one, because I've got an uncle that lives in the UK, and he is married to another doctor. And one of his concerns going forward is, now that schools are shut, for healthcare workers, who's going to take care of their children? If both parents are doctors or nurses or anyone in the healthcare sector, who's going to take care of their children? They can't get a nanny or a maid or a domestic worker or anyone to come in and look after their children. So how's that going to work? And I foresee that problem arising in South Africa for children of healthcare workers. Has the government thought of a plan of how they're going to take care of their children? In the UK now, what they're doing is they're opening school just for the children of healthcare workers. If both parents are healthcare workers, school's open for them. So they have somewhere to go. They can be taken care of. Because right now, if me and my partner are both doctors and we have 2 kids and both of us have to go to work, who's going to look after them? Do we take them to work? What happens? These are my questions. The government needs to come with some solution to that problem. I know it's a smallish problem and they've got far bigger problems to look after, but I mean, that's just something to consider. Going forward, obviously, middle-class citizens that own businesses, small and medium enterprises, by the day are not only losing money, but are becoming bankrupt and are having to shut down. Like I myself, I have a company that I've registered not too long ago for all my comedy performances. What's going to happen to that company? I don't know. I'm not getting any money or any revenue coming in consistently. So what is going to happen? I'm worried. And I don't have any employees that work under me. I'm the sole employee of my company. But what about everybody else? Restaurants, bars, who can't stay open for 3 weeks. How are they going to pay their staff? Do they fire people? Do they give them a wage cut? I mean, in order to stay afloat and to continue running, something's got to give. Is the government doing enough, giving enough money towards relief to these businesses? I don't know. These are the questions. These are the limitations I feel are important ones to consider going forward. And as a result of businesses going bankrupt, especially the small and medium enterprise in South Africa, this will leave a lot of the lower socioeconomic class group of people without any form of employment. That, in turn, as we've seen in our country and in other countries, when you have such a vast difference between your middle and upper socioeconomic class with your lower socioeconomic class, like South Africa and Brazil, and many other countries in the world, it leads to crime. I'm worried about the wave of crime that's going to hit us after the lockdown. Already we're seeing shops being looted, certain grocery stores. I mean, these are basic necessities that people going after. On top of that, clothes, other things. Stores are being looted. Crime has already started. And I just hope that the government doesn't take such a lax approach. After the lockdown, they've got to be more forceful in terms of controlling crime in the manner that they have been doing now, and enforcing laws that prevent this type of rapid unemployment from occurring. Because people are losing jobs. People don't have bread to feed their kids. It's going to get tough very quickly. So just bear that in mind. And now the financial implications, obviously for everyone, is going to be huge. The healthcare system is requiring billions and billions of rands to try and bail themselves out of this situation or prepare themselves. If you look at the hospitals, we are just currently preparing ourselves for the wave of serious cases that we anticipate will be coming in. And apart from us requiring money, what about every other sector? There are a lot of comedians, entertainers, musicians that are also going to completely lose their livelihood, lose their apartments, lose their houses. People in the service industry, restaurants, bars, nightclubs, all of them are going to lose. That's a lot of revenue in terms of tax for South Africa. And I just hope that we have a deep enough disaster relief fund to take care of all of us when this thing is over. Which leads me to my last point. How long do I think this is going to last? People have asked me this question every day. Is there a possibility for the extension of the lockdown? And my honest opinion is yes. Yes. This lockdown is going to go on for more than 21 days. They might lift certain restrictions, but definitely it's going forward. I mean, if you look at America, they've extended theirs past July, Italy as well. I think it's naive to think that in a country with such high numbers of immunocompromised and vulnerable patients, that we aren't going to see at least a rapid spike in cases or severe cases or deaths in the next few weeks that would have to push the government to do something drastic. They still need to roll out water, make space, depopulate certain areas. In 2 weeks, they're not going to be able to do that. People are cramped, living on top of each other. Already we've got cases in Alexandra. Now, I worked in Alexandra at a clinic, and I was actually based at the HIV side of Alexandra Clinic. And I think in any given day, if you walked into that clinic, the majority of the patients were all HIV patients coming to get their CD4 count or viral load checked, renew their medication. And a lot of these people, unfortunately, were unemployed, living in informal settlements on top of each other. Now, if you've got one case there and it spreads to some of the most vulnerable people, which are HIV positive people who are immunocompromised, whose immune systems cannot mount a strong enough response to COVID-19, what's going to happen? You're going to have rapid spread. And here's an interesting study that I found by Van der Vries Tittelaar and Albert E. Oosterhuis. And these guys, look, there aren't enough studies on specifically COVID-19 and immunocompromised people, but there's a lot of studies on SARS, MERS, influenza, swine flu. And in this particular study, they showed that in humans and in ferrets, which are a little like mice type things, that the virus actually lasts longer in a person who is immunocompromised. So somebody with HIV, with cancer, anything like somebody that's exceptionally old. In those cases, the virus actually lasts longer in the system. So even though they may feel fine after they've gone through their disease, they suffer more and they develop severe symptoms. But after they've got no more symptoms, they still hold the virus some between 21 and 28 days, which means they can continue infecting people after that mark. Now, if you have that many immunocompromised people catching this virus, which is likely going to happen in the next week, they're going to continue shedding that virus for the next 21 to 28 days. If the lockdown's only 21 days, those people are going to go out once the lockdown's over and infect everyone. And that is why I believe this lockdown is going to have to continue further. Because if HIV positive and immunocompromised patients are going to catch this virus, it's going to extend far longer, because by letting those people out, you're going to infect much, much more. And we've got to weigh that against the obvious financial implications that we're currently facing. And lastly, just one more thing before I leave, and something that I think is very prevalent in South Africa and society, and something that we could have all anticipated. I've been hearing reports from many different sources about high rates of domestic violence and child abuse cases that have come through. Friends of mine that work in the pediatric department have said this. And we knew that this was coming. So we've got to act fast. We've got to act swiftly and with purpose, because otherwise the most vulnerable in our society are going to be affected by this. Not just by the COVID-19, but also at the hands of the people that should be protecting them. That's government, and that's fathers and caretakers of children and vulnerable women in this country. So, good luck to the government. You guys are doing a great job currently, given the circumstances. But I think certain things need to be ironed out. And we got to sort this situation out before it gets much worse. But well done thus far. Anyway, thank you guys for listening to another episode of The Daily Dose. I hope that you guys have enjoyed. So take care, stay safe, wash your hands, and I'll see you again tomorrow for another episode of The Daily Dose. Goodbye. Peace, love. Assalamu alaikum.